Midwifery care is so unique. I think it's so beautiful how midwives work in so many different capacities. Um, Many midwives give you almost like an a la carte option. They support you in the hospital setting. Um, as a doula, they can go a little bit further and support you as a Monitrice in the hospital. And the difference between a doula and a Monitrice is that Monitrice services offer a little bit more like prenatal care. So with Monitrice services, a mother will receive about 3 to 4, even 5 visits of just prenatal care, doula care as well. But Monitrice services allow the midwife to do a little bit more medically. And so the difference is the price in the skill set that the midwife will be using. For an example, for doula services, a midwife might charge $1,500 to $1,800, but for Monitrice services, a midwife will charge $3,500 to $4,500, where you do get cervical checks before you're transferring to the hospital, and you are getting your vitals checked, and you are your baby. We're listening to your heart, the baby's heart tones. That's where we are just about almost having a home birth, and but a lot of your labor will be at home, but you go to the hospital to deliver your baby. And then you have full-on midwifery care where your midwife provides all of your medical care that you need. She sends you off for your ultrasounds. You are not working with an OB unless you decide. You have the ability to see an OB as well as have a midwife. Why not? It's nothing better than using the things that you work hard for. And I believe that if you pay insurance monthly and you have the option to have an OB for backup for any emergencies, as long as you know how to have the balance between, respecting the craft of midwifery and trusting your midwife, but understanding that your OB is just there for any emergencies if needed. And again, if you have insurance and you're not paying a major copay, then go with having an OB and a midwife. It's a great option. And have your home birth or your birth center birth as you decide to have. Other things that midwives do is we provide postpartum support. And depends on the state, the midwife, and where you're at. Some of these midwives will offer further care like night nanny. Some midwives do placenta encapsulation. So midwifery care is a broad spectrum of care. It's a broad care. We care for women where they are at, and that is what is important when you are looking for a midwife. You're not only going to ask what are your prices, but you want to know how do you provide care, what are the services that you provide, and get familiar with some of their a la carte services as well. Here at Eden's Garden, I provide Monitrice care and services to some women who we take just a very few per year. And we offer home birth services where I care for my families from the time they conceive up until 6 weeks postpartum. We are meeting every 4 weeks at the beginning of pregnancy, and then after 28 weeks, we start meeting every 2 weeks. And then after 35, 36 weeks, we start meeting once a week. And in these meetings, we are talking about diet, exercise, and ways to stay healthy throughout the entire pregnancy. It is my goal and intentions as a midwife that all of my mothers are not only prepared for childbirth, but they are just physically fit and feel good, and that they are healthy. That is the most important thing. For me, it is not that we have a baby in a birth center or that we have a baby in a home. That is what is most important to me. It is that my mothers remain a low risk at all times, and if they do become high risk, I am to provide the best care that I can within the hospital setting for them. So a lot of our moms choose not to have that extra OB. But if we have mothers who might have like military insurance where they don't pay a copay, or just great insurance, like I'm all here for it. You go see your OB, just make sure you're coming to see me as well. So as you choose your midwife, keep some of these tips in mind in regards to a la carte. What services are you willing to provide? What services, like, are you willing to be a doula as well, if that's the route that I want to go as far as a hospital route?